My name is Dr Anne Allison and I'm a salaried GP working for the Primary Care Support Unit up in Aberdare Surgery. The Primary Care Support Unit is a unit employed by the local health board, and they put salaried GPs into practices that actually need a little bit more help to provide a good standard of care. This tends to be in areas like the valleys, where a lot of the GPs are actually approaching retirement age, and therefore we need to get new blood into the area. There are lots of benefits to being a salaried GP employed by the local health board rather than being a principal GP. The major benefit tends to be the fact that you are supported a lot more than if you're on your own as a principal general practitioner. The network of the Primary Care Support Unit and the local health board are extremely supportive and do help with any problem. If there are any clinical concerns or any other issues that you may have, we're supported very well from a mentor point of view with a senior general practitioner. Working as a GP for the Primary Care Support Unit and the local health board in a managed practice has helped me fulfil a lot of my educational needs, but also fulfil a lot of my professional needs as well. I'm very happy in working in a developing practice and feel I can contribute a lot to the management of the practice, but also for general patient care and improving the standard in the Valleys areas.
Hi, I'm Dr John Holland. I'm a GP in Gethley-Gare. I lead the Heads of the Valleys project in the Caerphilly area, and I'm also clinical director for the provided services of the LHB. I just wanted to tell you about some of the really exciting stuff that's going on in Caerphilly in terms of driving up the standards of primary care, so we provide a better service for our patients and improved healthcare for the population. Another really interesting piece of work that I think has been key to the success in Caerphilly is our close links with Cardiff University. We've done some important work with the anaesthetic department around chronic pain in the community. We've recruited patients for various other studies, and the clinicians here are also involved in some research about clinicians' behaviour, about changing prescribing, especially around antibiotics and sore throats. Another important part of the work we're doing is about teaching and training, and that takes two strands really. First of all, training our own staff. For example, all our current salaried GPs are undertaking diplomas or certificates in chronic disease management. I think that's important for their future and the future of the patients. One of the really important things about all this work we're doing is that it improves recruitment and retention. It makes Caerphilly a really exciting place to work. The other really important thing is that we share all this learning, and we do that in a variety of ways. We've contributed to the managed practice workbook that's available through the Teaching LHB, and we share our skills and knowledge locally with whoever wants them. Our practice manager regularly supports other practice managers, especially around HR issues.
The main aim of the project has been to ascertain the current service provision across RCT for patients diagnosed with epilepsy. We've then looked at those services and compared them with national guidelines and recommendations for epilepsy care.
Hey Sharon,
How are you today?
okay? Thank you.
Throughout the project, we've actually used 3 clinicians who've worked for the local health board. They've carried out a number of clinics across 11 practices, and 506 patients have been identified across those 11 practices. We need to look at areas such as, can the patients drive? Are they employed? Are there any side effects from medication? Which this now looks at a more holistic approach and looking at patients who can then lead an active life even with a diagnosis of epilepsy.
My name's Andrew Rogers. I'm a head of department here at the University of Glamorgan. My department deals with professional education and service delivery.
I'm Ruth Davis. I'm Head of Care Sciences, which is a department covering nursing, midwifery and social work within the Faculty of Health, Sport and Science at the University of Glamorgan. About a year ago, we went through a process of institutional agreement. This is a partnership arrangement between the Teaching LHB and the University of Glamorgan. That gives us an opportunity to work in partnership with the service providers locally to provide courses and a variety of other arrangements to suit the needs of people in the service. The service is changing all the time, and by service I mean both healthcare and social care. My department looks at midwifery, nursing and social work, and increasingly health and social care are coming together, and I think this creates an opportunity to look at new ways of working, to look at modernising the workforce, to looking at the educational preparation for those people, and by working in partnership we can identify what the needs are and how we can prepare people to meet those needs.
My name's Karen Gully. I'm Medical Director at Caerphilly Teaching LHB. One of our most innovative projects has been the development of clinical fora in the borough. Before 2005, we didn't have an opportunity for local GPs and practice nurses to get together to network and to attend educational events. And so the introduction of that has been a significant improvement in terms of our ability to engage with clinicians and also to support them in meeting with secondary care colleagues and receiving evidence-based education. We've also used this as an opportunity to disseminate information from the LHB, but also to share some of the good work that's gone in practices to provide some positive feedback. And I think that's certainly contributed to the very positive response we've received from GPs and practice nurses about the opportunities that we've offered. In the future, we'll use the experience that we've gained to establish a pharmacy forum, and we're also talking with dental and optometry colleagues to explore how we might work with them to offer similar opportunities. And I think all of these events are significant in terms of our recruitment and retention strategy, as they are definitely establishing very strong and exciting clinical networks in the borough.
My name's Louise Morris. I'm the clinical nurse specialist for Looked After Children in Rhondda and Taff, and I manage the Promoting Health for Looked After Children team. It's part of the Umbrella project, which brings education, health and social services together to work to achieve the health and well-being of looked after children in Rhondda and Taff. Peer mentorship scheme is aimed at children and young people who are preparing to leave care or who have already left care and are living independently in the community. The peer mentor will be a care leaver themselves from Rhondda and Taff, between the ages of 18 and 24. Our aim is to extend the peer mentorship system into other areas such as education, training and employment, in order to work together with children and young people who are looked after to expand their opportunities and to give them the support that they need when they need it. We know it'll be a huge success. We know it's an appropriate way of working with children and young people in order to help them achieve the healthy and satisfying lives that they deserve.
As a school, we deliver the national curriculum in terms of PE and physical activity, but we're quite unique in running a wide range of after-school activities and programmes. We've got quite a unique programme here in Porth County Community School called E3+. That is worked in conjunction with our 5x60 coordinator and also a wide range of volunteers and support workers through our PEST programme, University of Glamorgan and Local Health Board. That enables us to run a programme that develops specific skills, and using professional coaches, using volunteers enables us to provide a quality programme and therefore upskill our young people, improve their health and their fitnesses and hopefully their life prospects.
Sports students at the University of Glamorgan are actively involved in organising and delivering after-school clubs. The programme aims to help increase physical activity and sports participation within both primary and secondary schools in Rhondda and Taff. Students during the first 2 years of university will learn and develop the vocational skills required to work within the community. To ensure the high quality of the scheme, students will also study a number of nationally recognised coaching awards. This is an excellent example of multi-agency partnerships working. Rhondda and Taff and Caerphilly Teaching Local Health Board is fully committed to the scheme and has helped secure funding from Rhondda and Taff County Borough Council to enable students to study the coaching awards. A key aim of the scheme is to make students more employable, giving them the suitable work experience to enable them to work in the industry. A primary aim is also to help local objectives, particularly to get children more active and improve physical literacy. The Climbing Higher and Designed for Life strategies clearly outline a number of key challenges in the next 10 years in Wales, particularly in terms of getting children more active, reducing childhood obesity and long-term chronic diseases such as diabetes. We very much hope we are helping to meet these national objectives as well as the 5x60 agenda.